Back to Wave Listens Live. We are with the neuropathy doctor, aka Dr. Doug Kane, here at Cornerstone Wellness. It's a takeover show. We're here for segment 2. Tell everybody where we are.
So we are at 3602 Northgate Court, Suite 17 in New Albany. We're just off of Grant Line and I-265, close to Pacers and Racers and Heavenly Ham.
So many different people have come through these doors and have walked out with incredible results. They're results that you're proud of. You share them all the time, and we've heard from so many different people that you've been able to help, especially by the way of neuropathy reversal. It's something that you've been doing for the better part of the last decade, something you've really been trying to increase the ability to help those people that are coming in struggling with that, just to get back to a normal way of life. Tell me about that. Tell me what we got behind us, and tell me about those ways that you're helping people get that feeling and their life back.
Sure. So neuropathy is the #1 neuromusculoskeletal diagnosis that we see in the country today. Most of it's driven by things like diabetes. That's the most common cause. Chemotherapy-induced neuropathy, as we've talked about my mom on air for the last 3 years on Listens, is a very common cause. People that have had back injuries, back surgeries, sometimes hip replacements, knee replacements can affect the nerves going to the feet, and they can come out of that having a successful surgery, but then having some side effects of some of those nerve damage. And so what we do in terms of dealing with neuropathy and help people treating the symptoms of things like the pain, the electric shocks, the hypersensitivities, the numbness and balance issues, the kind of things that keep them up at night to where they can't get a good night's sleep. So we have treatment that they do on their own at home, and then we had adjunctive treatments that we can add to their therapies here in the office that accelerates that healing so they can see those results more quickly.
And walk me through some of those therapies. You've got a few more willing participants. You must really treat them well if they're willing to keep coming on. You seem to have so many people that want to come on and just show what you've been able to help them do.
Yeah, they're wonderful people, and we appreciate them. So one of the devices that we use is something called Soft Wave. We have that going on over in a room here. What that does is it uses acoustic waves to actually stimulate healing in the feet. It's great for reducing pain almost immediately. It increases blood flow, so we have better healing. And the big thing it does is it stimulates your body's own natural stem cells. So that's how we heal normally when we have an injury. And this device from Germany, it's been in the country for about 4 years. We've had it for about 3.5. It helps stimulate those stem cells so we get a better healing response. One of the things that we can also use is something called decompression therapy on the lower back. So we have a couple of different devices where we can use that. One is called the Back on Track chair, and we have Mallory demonstrating that. And so what this does is this is a good, gentle, decompressive stretch of the spine. It helps open up the disc spaces. It helps increase disc height, so it relieves any kind of pinching on the nerves. This one tilts the patient back in kind of an anti-gravitational platform, and so it's very calm, very comfortable, very gentle. And then we have another device over here that we have Linda on, and this is actually our Triton DTS, and it is a little more of aggressive traction. This actually kept me from having surgery about 20 years ago when I had a massive herniation of the L4 disc in my lower back. So again, this opens up the disc space. You can see how the lower spine is just being gently tractioned apart, and again, it helps rehydrate those discs so they can thicken back up, and again, give those nerves going to the legs more room. So anybody that's got low back pain, a lot of sciatic type pain, numbness and tingling down the legs, these are a couple of devices that will help dramatically at home. And one of the things that I'm going to show here, just kind of walk into the frame, is this is called our TheraRay. This is red light therapy. You've heard a lot about red light therapy here lately, and it's actually not plugged in, but that's the joys of live television.
I feel like we've seen different ads and stuff for red light all over the place. When especially like Christmas time, you're looking for gifts. It's all like red therapy device or red light therapy devices.
So there's different frequencies of red light, and different frequencies do different things in the human body. What's nice about this is 15,000 milliwatts. Most of what you can buy on the internet is 8 to 1,000 milliwatts. What that means is a difference of treatment time from a half hour to 30 to 40 seconds with this. So you can treat a lot more places of the body, and you can do that much more quickly.
How does that work? Like, the light itself interacts with the muscles?
Exactly. So it interacts with the blood vessels. It helps create something called nitric oxide in the human body, which is a powerful vasodilator. Again, more oxygen, more nutrients, more healing to the tissue, and we can direct exactly where we want that to go, whether it's the low back back or the feet for somebody with neuropathy, or shoulders or knees for other different sports injuries. So there's a lot of different ways that we can approach that.
And that's one of the things that I always find interesting about all the different things you talk about. It's diagnosing and being able to help so many different types of issues, from neuropathy to the different back issues like you mentioned. How does it work when somebody comes in, they know they have a problem, maybe they don't know what it is? What does that look like on your end, being able to make sure that you're diagnosing it correctly, but also getting them the treatment that they need at the end of the day?
It all starts with listening, Sean. If you listen and ask the right questions, the patient will give you 90% of the diagnosis. That's what we're taught and trained to do. And so we start face-to-face with a deep consultation in history. We go through an evaluation, examination. We do x-rays if necessary, and we find the root cause. And so that's what we're passionate about, is bringing new technologies into the office so we can share those with the community. So whether it's neuropathy or pelvic floor issues that we'll discuss here in the next segment, or chiropractic, musculoskeletal type issues, or even from a nutritional aspect, we want to do what's necessary to help the body heal itself from a very non-invasive, holistic aspect and direction. There's a time for drugs and surgery, but those should be more of our last result.
MyDrCain.com, that's a good place to start. You can also call or text the number on your screen as well. So many different ways that you can help somebody get their life back. And one of the ones you just mentioned, pelvic floor strengthening. That's something that you're working on. That's something that's big for you right now. And we'll explain a little bit more about that when we come back from the break. We will see you in just a minute or two.